Good afternoon, everyone. Today's topic is about social determinants of health and lifespan health issues in national and global health. These are our topics about social determinants of health and lifespan health issues in national and global health, and also the complementary and integrative health approaches in national and global health. So, as you know that the globalization has increased our awareness of health inequities across population groups in local, national, and global contexts. We know that there are leading health indicators such as access to healthcare, clinical preventive services, environmental quality, immunization, injury and violence, maternal, infant, and child health, mental health, oral health, overweight and obesity, physical activity, reproductive and sexual health, social determinants, and also the substance abuse and tobacco use. So we know that there are global health inequities that are manifested in group differences in health status, outcomes, and access to health services. So the European countries and WHO also have adopted the notion of social inequality and injustice as the explanation for differences in morbidity and mortality in populations. According to WHO in 2019, social determinants are the conditions in which people are born, grow, live, work, and age that are shaped by the distribution of money, power, and resources at global, national, and also the local levels. And these conditions are mostly responsible for health inequities, and health inequities are attributed to systemic inequality in the allocation of resources and power, and they are linked with the social injustices that produce health inequity because of unfair distribution of goods, services, and privileges across populations. Equity refers to fairness in the distribution of goods and services based on need. For example, of the social determinants of health, according to WHO, such as income and social protection, education, unemployment and job insecurity, working life conditions, food insecurity, housing, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, structural conflict, access to affordable health services of decent quality. And needs are not necessarily equal. Thus, equal opportunity or equal allocation of resources that ignores differences in needs generally fails to achieve equity of outcomes. And the social justice has become the focal emphasis for addressing health inequities by emphasizing a collective societal moral obligation to create equity in the allocation of risks and rewards to everyone. So this is the framework of social determinants of health according to WHO, which demonstrate how social, economic, and political factors such as income, education, occupation, gender, race, and ethnicity influence a person's socio-economic position, which in turn plays a role in determining health outcomes. So these factors actually can influence a person's ability to lead a healthy life. and influencing things such as quality of housing, opportunities in the built environment that encourage our physical activity, and access to healthcare services. And in this framework, that WHO also explained about the social determinants of health into broad types that work together to impact health and well-being. And these determinants are such as structural determinants, which include socioeconomic status and community or societal context, and also intermediary determinants, which include the living and working conditions of people. And health disparities can be traced to a sequence of events and is signified by a difference in environment affecting access to, use of, and quality of care that leads to a particular health status or health outcome. And we know that other factors such as the environment also incorporates both physical and social factors that impact health status, such as exposure to pollutants, overcrowded and unsafe our living conditions, and also the resources as well, poor resources, which are associated with poor health. And stressful environments lead to the chronic experience of stress that we all know that uh, nowadays people are more prone to get stressed daily, and both mental and also physical. We know that where people live matters for their long-term social and economic success because of the detrimental effects of living in poverty area. Is also related to the racial issues, and also maybe the local policies and also the practices, and also we have to promote the equal opportunity to the minority populations as well. And these are the examples of the social determinants of health in Indonesia conditions based on study from Schroders. So these tables explain about the social determinants of health according to the child health. So this is the place of residence and child health in Indonesia. Uh, Differences in rural and urban areas. So we know that there are several factors which influence the uh, our health in Indonesia. Poor household and community infrastructure, and also the malnutrition. These are the big factors that happen in rural people, and also low vaccination uptake, and also the supplementation, and also the breastfeeding issues, and maybe the social cultural issues related to the immunization, and also the health system, which is poor access to health facilities, and also the quality of health facilities, and the number of inactive or closed clinics, or maybe the issues of healthcare professionals. And in urban areas, there are also issues such as double burden of malnutrition, and also the case of poor exclusive breastfeeding, and the income issues that we have a big issue with the more insecurity of food and malnutrition, and also the household and Also, with the social factors such as social cohesion and also the stress of our people, especially in this pandemic era. And also, with the high income people, we have found that there are some people that has overweight and also poor breastfeeding and increase the formula milk. And this is the education and child health in Indonesia. We have issues also with the poor hygiene and also the public health knowledge regarding the malnutrition and also the social pressure which happen also the miscommunication and misconceptions about the treatment and less use of modern healthcare services which people prefer to go to the traditional services rather than the modern healthcare services. This happened also because of the financial issues and also the habit of people to go to the traditional services and also the discrimination by healthcare workers which maybe people who have private health insurance can get easier to the access of healthcare compared to the public health insurance. And with the gender empowerment and child health in Indonesia, we have issue with the poor decision-making power among mothers and women, and also with the community participation and issue with the ethnicity and child health. Uh, this is about the preference for the traditional healer that people like to go to the traditional healer rather than the modern services, and also with the home remedies and self-medication. And a lot of people also still go to the traditional birth attendants in rural area because of the issue with the transportation or maybe about the financial issue with the health insurance also. So this study explained about determinants of poor child health condition in Indonesia, such as the health system, malnutrition, low health literacy, gender, and ethnic inequalities. And this is also the short, medium, and long-term policies and efforts to accelerate improvements along the five key determinants of child health inequities and for closing the gap in child health in Indonesia. So the short-term perspective to improve daily living conditions related to the child health policies, we have to improve measles immunization coverage and also strengthening the implementations and also addressing the other strategies to reduce the stunting and also develop family level child health strategies and strengthening the behavioral changes at the household level. So it is important for us also to improve not only the health policy but also to the family or household level. In medium-term perspective, we have to strengthen and improve healthcare facilities, improve community participation and mobilization, enhance policy advocacy for disadvantaged provinces, and for long-term perspective, we have to make an integration between stakeholders and also the cross-sectoral strategies to accelerate achievements of our target for improving the child, infant, and neonatal mortality. So actually, we have to do a big approach, a comprehensive approach to improve our early life development. And this is also according to the previous study by Taylor about the sexual and reproductive health. Sexual and reproductive health promotion framework actually provides a comprehensive approach that identifies priority target population groups, which settings for action and areas for health promotion to redress sexual and reproductive health inequality. And the public policy is also inclusive and responsive to diverse population groups, and as such, language and subsequent policy interventions move beyond the heteronormativity that leads to persistent and pervasive gender and sexuality norms. And diverse populations are engaged in public policy review and law reform processes in order to ensure cultural and gender appropriateness is embedded and institutional and structural violence and discrimination are prevented and access to affordable and culturally appropriate health services is improved. And we have to develop the interventions which are designed to redress pervasive gender norms and stereotypes and promote diverse understandings of gender, sexuality, and sexual identities. And sexual and reproductive health service provision is accessible, should be affordable, and culturally appropriate, and is informed by and meets the needs of diverse population groups' cultural and religious beliefs, attitudes, behaviors, and life experience. So, as a nurse, we have to identify first the social determinants of any specific issue with the global health, and also the behavioral determinants and the population target, and also the strategies which meet the needs of the population. And we also have to integrate with the uh, policies, the local policies, and also the media to gain this issue. So this is the life course health development model, which has 7 core principles that explain about health development is an emergent property of living systems. And health develops continuously over the lifespan, and it is a complex process and sensitive to the timing and social structure, and also with the environmental exposures, and it enables and constrains our health development pathways. And as a nurse, we also can promote the survival and enhances persons to thrive and protects against the disease. And we know that it is an evolutionary processes. So this is about the biologic adaptation, but behavioral adaptation, and also the developmental adaptation. So we need to know about this lifespan also is a change process. So this is a dynamic process that we know that everyone have the ability to adapt through the lifespan. And this is the conceptual framework for a life course approach to health according to WHO. And in this chart, explain about the functional ability and intrinsic capacity. That intrinsic capacity refers to the internal attributes that we are born with, such as our physical and mental health, and this can be boosted by a supportive environmental and social factors throughout our lives. Therefore, contributing to our functional ability. And this could include, for example, wearing glasses to correct poor vision and drop pavements to enable easy access for pushchair and also with the wheelchair users. And if our attributes are still developing or reduced, then the environment takes on an even more critical role in maintaining and improving functional ability, enabling people to be or do what they have reason to value. And there are also supportive environmental factors that can enhance functional ability throughout life. For example, a young child's functional ability can be demonstrated by the ability to play well. And meanwhile, in older age, factors such as the environment, for example, safe streets and appropriate housing, can impact positively on mobility, which in turn supports their functional ability. So this life course approach means that we can identify some of the opportunities that we have for minimizing risk factors and enhancing protective factors through the evidence-based interventions through the research from the prenatal period through the early childhood to the adolescent working age, preconception, and the family building years and into the older age. And it also capitalizes on the potential to deliver an intergenerational approach to the improvement of our health and also to reduce health inequalities from generation to generation, and this can improve the conditions of our life. Today's nurse must be knowledgeable about what constitutes health because one of the primary goals of nursing is to assist the individual in achieving the highest level of health. And we know that WHO defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease. That is, as a nurse, we have to consider health to include not only physical aspects, but also psychological, social, cognitive, and also the environmental influences. And physical health is influenced by our genetic, which includes all the characteristics that people inherit from their parents. And these characteristics not only include physical features, but also may encompass genetic weaknesses or disease. So we know that some people are prone to certain disease. And the psychological health refers to how we feel and express emotions every day. And social health deals with the everyday issues of the economics, religion, and culture, and the interactions of people living together. And cognitive health encompasses a person's ability to learn and develop. And also with the environmental factors, we have learned from the previous classes, there are issues such as water and air quality, noise, and with the pollution as well. So, as a nurse, we know that the holistic approach to health recognize individuals as a human being, as a whole human beings. We can promote all aspects of a person's life, and this approach helps the nurse to understand a person and attach their significance, value, and meaning to each life. And the holistic view further helps identify the similarities and differences among people and allow decision making from the person's own unique perspective. And positive nursing outcomes using the holistic approach can emphasize the independence of patient and also maximize their potential. And according to the NCCIH in 2021, complementary approaches can be classified by their primary therapeutic input, and which is how the therapy is taken in or delivered, which may be from nutritional, such as special diets, dietary supplements, herbs, probiotics, and also maybe the microbial-based therapies, and with the psychological, such as meditation, hypnosis, music therapies, relaxation therapies, and with the physical, such as acupuncture, massage, and spinal manipulation, and also with other combinations such as psychological and physical aspects such as yoga, tai chi, dance, art therapy, and mindful. So with the CIM, there are also other internal forces such as body systems, mind, neurochemistry, heredity, and also with the external forces such as culture, community, family, and biosphere. And according to the Brooks study, this is the study about the integrative and also with the same approaches related to the allopathic approaches to healthcare. So we know that the use of CIM is increasing today, and the National Center for Complementary and Alternative Medicine has defined CIM as a group of diverse medical and healthcare practices and products that are not generally considered as a part of conventional medicine. And conventional medicine uh, has emerged also with the terms of Western medical model. And we know that the paradigm shift from CAM to integrative medicine reflects a need for a dialogue between patients and also the nurse and other healthcare providers regarding the conventional and CAM, and shared decision making between patients and providers is ethical, and it can preserve patient autonomy and considers patient values and preferences, and this may lead to improvement in their health outcomes. And this conceptual framework from the study suggests that shared decision making is a kind of vehicle that can help to achieve implementation of the integrative healthcare delivery. In a shared decision-making model of care, the patient and nurse or maybe other healthcare provider relationship is an interactional process in nature, and in that both the patient and the nurse are invested and actively involved in the treatment decisions. So as a nurse, we can facilitate the autonomy of the patient during the treatment. And in this shared decision-making process, this is also considered to be ethical by promoting truthfulness and openness, and also with the patient autonomy. And this allopathic medicine is essential to understanding illness and technological advances that can improve and expand healthcare. Integrating CAM, particularly those which are relevant to the self-care in the management of chronic disease, should be a part of the integrative health approach. And using a shared decision-making approach to healthcare delivery while addressing the needs of the whole person may lead to the a better of health outcomes. And we can see from the figure that screening and illness prevention or health promotion in integrative practice, it emphasizes prevention and health promotion, utilizing the physician as a partner in the patient's care. And adherence perceived barriers to treatment regimens, especially medications that can be decreased with the integrative health coaching, wherein both patients and nurses are also involved both in creating a nursing care plan. And with the patient satisfactions, patients perceive their own health as better when they are incorporated into an integrative health plan that aligns with their personal values. And patient goal setting and attainment. Patients whose providers encourage them to set their own goals may be more likely to achieve their goals. And this is inherent to the concepts of integrative medicine and shared decision making. So, nurses' improvement for integrative approaches. The first one is creating a culture of innovation and involvement of staff in alternative practices to accommodate the changing beliefs, needs, and demands of an increasingly diverse patient population served by the institution, such as a study of community practices of alternative therapies, and examine the institution or agency's policy, philosophy, mission, programs and practices to identify or maybe make an explicit the content, process, and outcomes of alternative therapies. And examples might be a review of existing programs of quality assurance, safety, the palliative care, or maybe others for sensitivity to and knowledge of patient cultural practices or other patient choices. And the third one, influencing clinical practice for recognition of patients' personal usage, such as history taking, becoming alert and respectful of patients' preference as demonstrated in care plans. And also we can encourage further research as well. And support also with the financially and maybe other support and guide programs of the staff recruitment, preparation, and continuing education in related to the alternative therapies. And we can also publish the nursing programs, studies, and reports on alternative therapy outcomes, issues, and other challenges. Structural inequities refers to the systemic disadvantage of one social group compared to other groups with whom they coexist, and the term encompasses policy, law, governance, and culture, and refers to race, ethnicity, gender, or gender identity, class, sexual orientation, and other domains. And the social determinants of health are the conditions in the environments in which people live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. And for the purposes of this, the social determinants of health, it is about the education, employment, health systems, and also the services, housing, income, and wealth, the physical environment, public safety, the social environment, and transportation. And for the interpersonal level, these mechanisms are individual knowledge, attitudes, beliefs, and skills. At the interpersonal level, they are families, friends, and social networks. At the institutional level, there are organizations and social institutions. And at the community level, there are relationships among organizations. And meanwhile, at the systemic level, the mechanisms are national, state, and local policies, laws, and regulations. So we know that it is a complex process to promote the health equity. So we need to get together with the all aspects of the social determinants of health. Thank you very much. I'll see you next time.